the supplements in general. So today I will just follow up or continue from where Dr. Wafa started and talk about the pharmacist perspective, talk a little bit about vitamins, about minerals, about supplementation, discuss a case together, and listen to your questions at the end, and I'll be very glad to hear from you. So I always like to start with evidence-based information from the literature that back up our talk and make sure that whatever we recommend to our patient is backed up with clinical evidence. So there's always an increasing demand for micronutrients in general to support the immune system during recovery from illnesses such as common cold and infections. And this is really a common season now that we need also to highlight. During infection, the level of micronutrients, for example, vitamin A, iron, zinc, vitamin C, they fall rapidly, which is likely to result from impaired absorption of these nutrients and increasing the metabolic needs and reduced food intake. And of course, according to the literature as well, zinc deficiency is associated with many chronic inflammation in children. There's a study that was conducted in Taiwan that found that zinc supplementation could improve appetite and growth in undernourished children. So this is something to also highlight. And there's evidence that shows that zinc lozenges are possibly effective in treating the common cold. In a systematic review, which is the best type or the strongest type of review and meta-analysis of 17 randomized controlled trials, which we know that the randomized controlled trials are the most powerful and effective, zinc was shown to reduce the duration of cold symptoms by about 1.5 days. So this is also something to highlight. The use of vitamin C, which is 1,000 milligram, and zinc 10 milligram combination, was also assessed in a pooled analysis of 2 studies on patients with a common cold. The results showed a significant reduction in the duration of the rhinorrhea, which also we talked about in previous webinars, over 5 days of treatment compared to the placebo. These findings from randomized trial demonstrated the clinical efficacy of vitamin C, D, and zinc in reducing the incidence and disease severity of different types of respiratory infection, such as the flu and the common cold as well. And here are like in the slide, all the articles where I pulled those information from to share with you. There's a small slide that I wanted to highlight also, which is a comparison of dietary references intake and therapeutic effective doses of some micronutrients. And of course, talking about vitamin C, D, and zinc. Of course, we have many that we will discuss throughout the webinar. The vitamin C, which is like dietary reference intake between 75 to 90, and the therapeutic dose against the cold and infection or common cold or infection that is used in clinical study is usually a minimum of 1,000 milligram. Vitamin D is usually between 40 to 4,000, and of course, depending on the vitamin D level, that usually we check the baseline, and based on the baseline, we do our recommendation. And of course, the zinc, which is minimum of 10 milligram in practice to have beneficial effect. Usually vitamins, what are vitamins? These are the complex organic compounds required by the body in very small amount. They are concerned with different type of metabolic function in the body and essential for maintenance of overall health. Since vitamins cannot be manufactured in the body, they have to be supplied through our diet. Vitamins usually are classified into 2 major types. We have the vitamin that are water soluble, like the B and C, etc., and we have the fat soluble, the ADEK. Usually the vitamin C, vitamins, we always, or the water soluble one, they cause a little bit of acidity on the stomach, so we advise the patient to take them with food, whereas the vitamin D or the fat soluble vitamin, we take them they can be taken without a meal or before food, which they don't cause that much irritation to the stomach. Of course, we'll start with the vitamin A, the retinol or retinal or retinoic acid. There are 2 forms of vitamin A in the body, a preformed vitamin A retinol and its esterified form. We have the alpha and beta carotene that can be easily converted to vitamin A as needed. But definitely we as pharmacists, we need to clarify to pregnant women the teratogenic effect of vitamin A in excessive amount. So we have to be careful. Avoid multivitamin containing vitamin A like fish liver oil. That means if you have a multivitamin that has enough vitamin A, you don't need to be supplemented with additional vitamin A. So this is something also we have to be careful about when we talk to our patient. The benefit of vitamin A are many. We have the beneficial effect on the vision. We have the skin that keep the tissue and skin healthy. We have the bones that are playing an important role in the bone growth. Cancer, of course, which is the lycopene, lower the lung cancer risk. This is also according to evidence. And of course, the antioxidant effect and the overall body system supporting the cell growth and playing a critical role in the normal formation. Benefit of the second vitamin is going to be the vitamin B1, which is thiamine. It helps to convert food into energy. And of course, it's needed for the hair, the brain, the muscles, and the skin as well, and helps in the nervous system, the heart, digestive system, and nerve tissues damaged by usually alcoholism. Riboflavin, which is a vitamin B2, it's usually needed for proper metabolism of fat and protein, the eyes, and of course, it is really helpful to convert food into energy. We have also the niacin that we have lots of patients coming and asking about the niacin and its effectiveness and what's the importance of niacin as a supplement or as a vitamin. Definitely it is essential in promoting healthy skin, healthy brain, and of course healthy nervous system. We have also the vitamin B5, which I get lots of patients asking about the pantothenic acid, which is a vitamin B5. This helps to make lipids or neurotransmitters. A deficiency of usually vitamin B5 is related to having low energy symptoms due to its role in energy production in the body. So symptoms including fatigue or general weaknesses, it could be a deficiency of vitamin B5. One thing that I wanted also to share with you is a rare vitamin B5 deficiency known as burning foot syndrome involves numbing and tingling along with burning and shooting pain in the feet. And that also is common with patients with diabetes as well. Vitamin B6 or pyridoxine, it helps in lowering homocysteine levels and may reduce the risk of heart disease. This is also one of the very famous vitamins that we get lots of questions about. It helps to convert tryptophan to niacin and serotonin, which is definitely a neurotransmitter that plays a very important role in the sleep, appetite, and mood. And of course, high level of homocysteine in the blood makes a person more prone to like cell injury, inflammation of the blood vessels, and of course, can lead to ischemic injury or heart disease. We have the biotin. I have lots of patients asking about the effectiveness of biotin. What's the dose of biotin that I have to take? Does it really cause skin breakout? Well, it depends on the company that makes those biotin and, of course, the effectiveness and the study that are made, and, of course, the reputation of the company. So biotin helps to convert food as well into energy and helps to make and break down some fatty acids, and it's definitely needed for healthy bone and hair. It strengthens the nails and the hair and keeps blood sugar levels stable, helping metabolism react to changes in the body. We have also the cyanocobalamin or vitamin B12, which is required to proper red blood cell formation, neurological function, and DNA synthesis as well. Well, okay, so biotin in high doses can be treated or can be used in the treatment of seborrheic dermatitis in infant. And of course, no adverse effects are reported. So this is also another thing that I wanted to highlight and mention. Of course, it's not, but definitely biotin will help in the, as I said, in the hair growth. It will help in the skin, how much the skin is vital, etc. And also it helps in preventing depression and elevating the mood as well, according to studies. Vitamin C, our famous vitamin C or ascorbic acid. Vitamin C, we have lots of research about vitamin C. It can lower the risk of some cancers, including those of the mouth, esophagus, stomach, and breast. Long-term supplementation of vitamin C may protect against cataracts or help with the vision, helps to make collagen. This is definitely when you have loss of collagen, having boosting your collagen intake by taking supplements of collagen usually is not sufficient alone. You have to take with it sufficient doses of vitamin C in order to support the collagen and make the effect even stronger. It also one thing that is important is the vitamin C supplementation improves the absorption of iron as well in the body. Vitamin D, our famous vitamin D, it promotes calcium absorption in the gut, and of course, associated with vitamin D deficiency, leading to rickets in infants and children, and osteomalacia in adults. And definitely, there is a certain age where children need vitamin D supplementation on a daily basis, especially infants, if they don't get enough vitamin D from their formula, from the milk that they take, especially if they're not breastfeeding. We have this activates protein and calcium essential to blood clotting and may help prevent hip fractures as well. So this is also a question that is asked by patient about vitamin K and what is the importance of vitamin K as a supplement. Other things I want to highlight is something like echinacea. A patient come asking about echinacea purpura. What is echinacea? Is it okay to take echinacea in the cold season if I have an infection, if I have a viral infection? So echinacea plays a very important role in immune modulation. It has evidence of working as an anti-inflammatory, antifungal, and antibacterial. It has minimal adverse effect. It has a little bit of GI upset, which can be managed by taking the supplementation after food. We have the garlic. Garlic has magnificent effect in protecting the heart, and of course works as a lipid-lowering agent, and it has antiplatelet effect as well. It has anti-neoplastic effect, which decreases the risk of having stomach, esophageal, and colorectal cancer. And of course, we have to use it with caution, especially when we review the full medical background of the patient. If they are, for example, on anticoagulant, if they are on other antiviral, we have to be cautious with counseling the patient about the interaction between the garlic and those medications. So that's why the pharmacists need to review the full medical history of the patient. Ginkgo biloba. Everybody comes asking for ginkgo biloba. What is the effect of ginkgo biloba? It is a best vasodilator. It promotes decrease in blood viscosity. It has an antioxidant effect, and it's also very good in promoting cognitive enhancement and enhance the cognitive function in patients. It works as an antidepressant and anti-anxiety agent. Same thing, to know the medical history of the patient, to know the medication history, because there is interaction between this ginkgo biloba and antiplatelet, anticoagulant, and of course other medication for HIV. We have also the milk thistle or Silybum marianum, which is an anti-inflammatory. I had 2 patients coming and asking for this supplement. They read a lot and they want to know if this medication really is an antioxidant, really works as an anti-inflammatory agent. Yes, and it also prolactin production, so, and it doesn't have any major drug interaction. We have the saw palmetto as well. Saw palmetto is essential because it inhibits 5-alpha reductase, and of course it's good for the health of the prostate in men, and of course minor adverse drug reaction like nausea or abdominal pain, and there's no famous or no major drug interaction with saw palmetto. Ginseng also, I wanted to highlight the effect of the ginseng, which is the most ancient Chinese herb, which is used for over 2,000 years and known as the ultimate herb among herbalists. It's used by lots of Americans regularly, and it has wide uses such as antidepressive agent. It helps with the sleep. It helps with enhancing the mental performance or physical performance as well. So patients do like asking about ginseng and like to be supplemented with ginseng and find it very effective. It has an interaction. Definitely, we have to check if the patient is diabetic, if the patient is taking any type of stimulants, because that can have also an additional stimulation effect, maybe increase the heart rate, and definitely counsel about that. Minor side effects like headache and like insomnia in some patients, but the effects or the side effects are not, they are manageable. Dietary supplement, usually they are not food, they are not drugs, they are not meant to replace foods, but they can supplement diet. There is a broad definition by the DSHEA in the States in 1994, of course, to define what are dietary supplements. They don't need pre-market approval, and they must be labeled as dietary supplement. And definitely, there is a need of a pharmacist that is aware and knowledgeable about dietary supplement to help patients get directed in the or have the right knowledge about which one to take and which one is the most efficient for them. So let us apply what we learned today by sharing a case and discussing it together. We have Sarah, which is a 45-year-old woman. She's interested in improving her overall health and managing her hair loss and common cold. So she has common cold and she has been suffering from hair loss. Sarah approached the pharmacy seeking advice on a dietary supplement. Please provide a suggestion. So certainly based on Sarah's interest in improving her overall health, managing her hair loss, and addressing a common cold, a pharmacist might recommend a combination of different type of vitamin and minerals. But definitely before that, we need to do a proper assessment and ask the most important questions: the medical history, what are the needs of Sarah, is one thing fits all? No, we have to ask questions that are related to Sarah only. So upon assessment, it was found that Sarah has been suffering from severe stress in her job. That's number one. Sarah does not like sun exposure. Sarah has been complaining of frequent colds and infection. That means she is immunosuppressed because of her stress. She has no major medical history, so that's important. She does not drink, but she smokes occasionally. So these important information are needed to be gathered by the pharmacist. Now, so which one of the following is the best recommendation for Sarah? Which one is the best? Now, I will read it out loud. We have a high quality multivitamin that includes a B complex can provide a range of vitamin, including biotin, which is associated with hair health. B vitamin also play a role in energy metabolism and immune function. That's number one. Vitamin D is essential for Sarah's overall health, and adequate vitamin D levels are important for maintaining a healthy immune system, which can be beneficial for preventing and recovering from a common cold. We have also iron deficiency can contribute to hair loss. So if Sarah has signs of iron deficiency, for example, she has paleness, she has fatigue, check her eyes if the color of her eyes changed or the white coloration in the eyes is getting more to a yellow. A pharmacist may assess that and check on that and recommend probably an iron supplement, definitely after also recommendation, probably asking Sarah, have you done a blood test recently? What was your iron level? What was your hemoglobin? So excessive harmful or excessive iron intake can be harmful to Sarah, and it's important to determine if supplementation is necessary through appropriate testing as mentioned. So all of the above are suitable to Sarah. Which one do you think is the most appropriate regarding Sarah's case? I would like to hear from you. So we will start the poll question, and we will wait for the best answer selection from. Okay, so based on the selection, I can see that 23% answered A, 9% answered B, and 1.8% answered C. And of course, we have the majority answered D, which is the all of the above. And definitely the answer is all of the above because Sarah needs a B complex multivitamin, including biotin, which is very essential for hair health, essential for the metabolism and immune function. And of course, the vitamin D is very essential for her as well. Adequate level will be helpful because she doesn't like to go in the sun. And based on evidence, there's an effect of the vitamin D onto preventing and recovering from a common cold. Definitely, the iron is essential, but after we check the symptoms, the physical examination, and we ask Sarah to do blood test, or probably asked her if she did blood test, what were her results. So excellent participation from our audience as usual, and definitely we'll go to the second question. Okay, let me see if I can switch the slide. Yes. Which one of the following is not the best recommendation for Sarah? Which one is not the best recommendation for Sarah? So we have vitamin C, number A. Vitamin C is known for its immune boosting properties. It can support the body's defense against common cold and also aid in the absorption of iron. That's number one, if we were to give her iron before. Zinc plays, number B, or option B, zinc plays a role in the immune function and may contribute for her health. The pharmacist might recommend a zinc supplementation or suggest dietary sources like nuts and seeds. That's option B. Option C, omega-3 fatty acids, which I did not discuss that much in my slide. Probably Dr. Wafa discussed more about omega-3 fatty acid and its intake, found in fish oil or algae-based supplement, is not proven to be beneficial for overall health and hair health. The absence of anti-inflammatory properties may increase the incidence of common cold symptoms. Option D, probiotic can support a healthy gut microbiome, which is linked to overall well-being and immune function. And definitely this can be beneficial during cold and flu season. So I will give you a little bit of time to think about the second case related to our patient, Sarah. I hope more than 90% will answer this question right. And as I see here, 39% only answered C, whereas 33% answered D, 15% answered A, and of course, B was answered by 11.9% of our participants. So still 39%, which is the most, like the highest percentage, which is not true. As I said, omega-3 fatty acid as health and hair health, the absence of anti-inflammatory, on the opposite, the presence of anti-inflammatory properties may increase the incidence of may decrease the incidence of common cold symptoms according to different type of meta-analysis and pool studies about omega-3. Omega-3 has a very beneficial effect, such as the EPA and of course ALA, that have beneficial effect in preventing cardiovascular disease and minimizing or helping in heart remodeling in patients. So, and of course, the study mentioned at least 1 gram of the supplementation of EPA and DHA together to at least 1 gram to minimize the risk of cardiovascular morbidity and mortality in patients suffering already from, for example, ischemia.